Thank you for all the, I think, 6 or 7 people who decided to stay for the session. Basically, I think one thing is during lunchtime, and maybe this hall, many people didn't know, but let's have it as a discussion. I think it's better than, and I'm used to this, particularly in regular conferences. We don't have too many attendants, though it's a very important topic which needs to be discussed. So. So let me start with a few questions. I thought my talk will have a lot of statistics, statistics about India and about healthcare in general, and also about eye care. Generally, because whatever we believe is actually not true. Let me ask you one question: like, which is the most visited monument in India? What do you think is the most visited monument by foreigners in India? No. So the common answer is Taj Mahal, but it's not. Do you think there is another second option? Can you think of another option? Actually, Mahabalipuram. Mahabalipuram is the monument which is visited by foreigners in large numbers. And what do Indians spend their money abroad? Like whenever people from India, out of India, money goes out as foreign exchange. And what is the reason for which India spends the most for foreign exchange? Tourism, no. Yeah. So education, basically, I think around $83 billion come into India as foreign exchange, and Indians spend around $80 billion spending for education of their children. Almost everything which comes in goes out of India for only for education. So I think it is important to know our country before we actually know more about the practice patterns and everything. And generally, I wanted to have this talk. I think previously we had this young ophthalmologist session where now what we see overall is a fear of the doctors to start a practice. Somebody coming out young, the ophthalmology practice scenario or dynamic is totally changing. One thing, the most important change which already has happened is that majority of the ophthalmologists are becoming women. Like in, for example, if you take in Chennai Regional Institute of Ophthalmology, I think 90% of the PGs are women. So maybe in future we may not have this women ophthalmology society. We might have to have a men's ophthalmology society because there will be more women. That's the most important change which is happening in practice dynamics. And second thing, basically, I think the younger generation which comes in has a different aspiration and different mindset. Many of them are not as aspirational or as entrepreneurial as the older generation. For example, if you take in Chennai, over the last 20 years, we have not seen more than 20 new individual practitioner owned eye hospital come up. For Chennai being such a large city, we don't have individual doctor owned eye hospital, less than 20 which is coming. And in terms of revenue also, if you see in Chennai, there are not more than 10 individual ophthalmologists who has a revenue of more than 7-8 crores. So if you take 20 crores, maybe it is only 2, 3 or 4 people. So the private practice and people wanting to start private practice is becoming more and more challenging. But still, I wanted to, the aim of this talk is to say what is happening in the country and why we as ophthalmologists are in a very advantageous position to capture that opportunity. So this is a quote by Raghuram Rajan, the previous governor of Reserve Bank of India. So he says that we are in a world where we don't know the value, fundamental value of any asset. So many times we see in our WhatsApp groups and other things where we keep cribbing about the profession, where we have complaints. A lot of times everybody is in an unhappy mood, but actually we are in a world where we actually don't know the value of being an ophthalmologist, and particularly at this point of time. And as Vivekananda said, if you want to know India, you need to study Vivekananda basically, because in him he was always positive. So the aim of this talk is also to bring out the positive aspects in Indian ophthalmology and particularly the healthcare scenario. So, as we started, let's understand our country a bit more before we actually dwell into the actual healthcare dynamics and then the ophthalmology scenario. So, April 2023 was a very important turning point because India overtook China as the most populous country in the world. So, basically, we have now been the most populous country in the world and 1.242 billion population, meaning so many people who will also need health care and in particular eye care. So we have the largest market of patients if you consider patient pool as a market also, and we are only 26,000 ophthalmologists. So basically I think so there is a huge population and less number of ophthalmologists. Definitely a good opportunity to capture the market by starting out practice. So let's see, these are some statistics, very interesting, because during our parents' time, health took a back end. Health was people used to spend more for education than healthcare. Whenever parents thought that children's education is more important than spending to their own health, but there is a shift now. People are spending more for healthcare than education. So meaning the attitude and the spending habits are changing, and the percentage of money spent for food or transport and a lot of different, even for recreation, people have started spending a considerable amount of money, and 2% of the income is spent for footwear and clothes. So a lot of change happening in the spending habits. I think that is something interesting to note, that healthcare takes a priority when it comes to spending. So this is another interesting statistics. Number of people who own car in India is around 7.5% now, which was only 6% in 2018. So around 1.5% increase in number of people who own cars in India. And in terms of bikes, 37% was in 2018. Now almost 50% of the Indians own a bike, or Indian households own a bike. So basically the spending capacity is increasing, the country is progressing, and number of people. So why I want you to see these statistics is just also correlate that people are also going to spend more for eye care, spend more for opticals and all these items. For example, uh, like today morning we were seeing one person who was selling footwear. So if you see which is the fastest growing segment in the last 5 years, the segment which is growing 30-40% every year is footwear. So footwear is growing more than toothpaste or other thing. Toothpaste segment is growing only 3% to 4% every year. But footwear, because now we see like our children, the spouses, they own. Previously, it used to be 1 or 2 pairs of footwear, but I'm saying that my sons are now having at least 10-12 pairs of shoes. So they don't even have space to keep the shoes. And even the rural population has started spending more and more money even on things like footwear. So same applies to eyewear. People owning 2 pairs of glasses, 3 pairs of glasses, or people spending more for cataract surgery, or number of people who are going to buy spend for LASIK treatments are also going to increase. Particularly this trend is seen in the metro cities. So there is a company called Relax. I don't know if you know, one of the fastest growing footwear companies in India. So buying a Relaxo share is more beneficial than buying shares of maybe something like a HDFC bank, or so. These segments are growing very fast, and you can see that 42% of the Indians are also eating out once in a month. Previously, going out to eat was like a very big thing. Maybe 10 years, 20 years back, going to a restaurant was a very big thing. But now I think 42% of the Indians eat outside once a month, and I think majority of our households, maybe 2-3 times in a week, is very common to order through Zomato and all these apps. and people spend a lot on tourism also, a lot of money, and 14% of the Indians spend 30,000 to 60,000 rupees per year on tourism. So the middle class is growing, and middle class will be one third of the global economy, which is around 64 trillion. So the increasing middle class is going to be the most important catchment area for our eye care also. So, and 88% of the people who will enter into the middle class will be from the Asian countries, and 380 million of them are going to be in India. So, basically, a very good prospect for ophthalmology also. That is the reason we see a lot of these corporate activities, lot of investment coming into the eye care scenario, lot of corporate chains opening up, lot of you being offered to get acquired by the corporates for a huge money. All these things are happening because the middle class is increasing and the spending power of middle class is also increasing. So this is the middle class composition. If you see, by 2030, the middle and upper middle class, which will earn an income of 3 to 12 lakhs per annum, is going to be almost 44%, or 44 plus 34. The poorer class is considerably decreasing. So meaning we keep cribbing about charitable eye hospitals and all these things. The catchment for those people are going to be reducing, and I think the middle class and upper middle class who earn 3 to 12 lakhs are going to increase. And as ophthalmologists, I think somebody in private practice, majority of us are focused on somebody who can pay 25,000 and upwards for a cataract surgery, and those patients are going to be particularly in the 34 to 44% category. So no better time to be in ophthalmology than now, because by 2030 this is the change which we are going to see. And the increase in household income, as you can see in this graph, projected for 2030 is 29 million of Indians will have an income of maybe that 3 to 12 lakhs. So as of now it is 1 in 4 households, so it is going to increase to 1 in 2 households. And elderly population has been constantly increasing, as you see in the graph. So by 2031 we will have almost 40% of the population will be in the elderly age group, population which will have cataracts and diabetic retinopathy and all these problems. So this is the size of healthcare market in India. So basically 638 billion. You can see that it's been constantly increasing. This is not only eye care but the overall healthcare market in India. And the number of diabetic patients in India, as projected, will be 134 million. I hope I'm not boring you with too much of statistics, but this is the reality. I think we need to understand these numbers to see where we are in a very advantageous position and why it makes sense to expand. If you are already practicing, to expand into more centers, or if you are not yet started, to start your practice, or if you are thinking of starting small, to start in a reasonably decent way to cater to this population. Or if you're thinking of a specialization, maybe diabetic retinopathy definitely has a lot of value, and retina surgeons are going to be having a lot of work and in demand. So I think this needs to be correlated with the actual disease scenario. And I think who is going to be our biggest competitor? Government is going to be our biggest competitor for the private practice, not the corporates, not the charitable, because government has been constantly increasing spending in healthcare. So basically, the quality of government hospitals, for example, if you take in Tamil Nadu, government hospitals are in par with the private hospitals. So you don't really, somebody doesn't have to go to a private hospital for a cardiac surgery in Tamil Nadu. So government will become our competitor. So rather than trying to fight and trying to crib, and how do we collaborate with the government, I think we need to change our mindset to be able to collaborate with the government. I think only way of survival, people who collaborate with the government will definitely do a better practice. So the eye care industry in India at present is 1.6 billion, is projected to increase to 3 billion in just 2 years. So basically going to be a lot of activity in mergers and acquisitions, investments coming in India. So if you take spectacle optical sales, this is the projection. This is how it's going to increase. Right from 2013 to 2023, in the 10 years, it's almost 2.5 times growth in the optical industry. Spectacles and sunglasses, you can see both are constantly going to increase. So how as we as ophthalmologists going to be a part of this increased sales in opticals? That is something we need to think. Other thing is, now capital is available at a lower cost. Previously, banks used to give loans at 12, 15, 16%. Now even there are options of banks giving at a lower cost. There is capital from venture capitalists which is available to us. There is a lot of way to get money to start hospitals. So it's not that you really need money to start a hospital. Even if you have little money also, I think you have a lot of options to get money and start larger centers. So the cost of capital has been considerably reducing, meaning that number of people who will start hospitals will also increase. So this is the lower interest rate. If you see, like right from 10%, we are at almost 8.5% in terms of equipments and bank loans. So we have been seeing that all these big chains are getting funded. 700 million rupees dollars came into all the eye care practices or the chains in the last 10 years. So 3 4 large corporates got that money. So I think we as individuals should also be trying to see how do we get into that, and how do we get into the VC activity, how do we get funded. I think we need to focus on those things, not being somebody who get acquired by the corporates, but why can't we join and become a corporate. I think that is something. Money is available, lot of money is still going to come. This VC thing has just started in India. Whatever we are seeing now is in the very primitive stages. Maybe next 10-20 years it's going to become multiple folds. No, none of our eye care players have still gone into an IPO, so we are seeing very primitive stage. It's that we are, though the money coming in is 500, 600, 800 crores, but whatever coming in is very less compared to the overall market size of the eye care industry. So these are some of the PE deals which you would have read in the previous recent times, like Dr. Agarwal got so much money, and ASG got almost 1500 crores, and Maxivision got 600 crores. So this money is also going to come into the individual practitioners in terms of acquisitions, in terms of partnerships, a lot of these things. So how do we actually capture that? So basically, if you compare of all the specialties, ophthalmology is one of the specialties which has got the good lowest investment and highest EBITDA margin. So that is why the PE industry is more focused on ophthalmology. It's not as expensive as setting up a cardiothoracic or orthopedic kind of a unit, or even for that case oncology is very expensive. Of all specialty, super specialty, eye care is the low cost investment. Though individually when we see, oh, setting up a hospital for an individual looks very expensive, but overall in the market ophthalmology is the lowest cost investment with the highest return. And you can see that most of our hospitals are getting a very high valuation. You get somebody practicing can get 8 times EBITDA, and generally previously we had somebody practicing had to close down his practice if his children were not ophthalmologists, but now everybody has a chance to sell the practice at a higher valuation. So basically we do have option for retirement which was not available before. This is something very interesting. So young ophthalmologists should also capture this opportunity, start hospitals, and maybe even sell it to the corporate. Can be I see a lot of doctors even in the 40 45 particularly in areas like Mumbai who got offer for 20 30 40 crores. So if you have some other options, you can always, there is an option to retire. I think this option was not available before. So right from starting to exit, I think we are in a very good scenario now. So when should you have started your eye hospital? I think waiting for the specialization and all these things, you can, if you think like an entrepreneur, I think you have to get the specialist to work for you. You don't wait for doing the specialization and all these things. I have one doctor now who is now, his father is an optometrist. He is now in second year PG. So he studies in one Tamil Nadu medical colleges. He is already in the process of starting his hospital. So basically, he is not waiting. He has the confidence that he can get doctors to work for him, because we have to move from the self-employed segment to the entrepreneur segment. If you are an individual doctor working in your own practice, you are mostly a self-employed. I think majority of this 6,000, 7,000 doctors in India are in the self-employed segment. But how many of them have moved from self-employed to an entrepreneur, where other doctors work for you, you create a system which gets you the money? I think if you have that mindset, that is going to be very important. And we are in one among those 27,000 doctors to have this opportunity to capture that value of this huge market size. And as I said in the previous slide, low cost of capital and increased funding options makes it easy to start and scale. It's not like previously where we had to struggle to start a practice. And there is a shift. Huge potential is seen in tier 2 and tier 3 towns, not in the bigger cities, because I have all the, from majority of the premium ophthalmologists who are always buying these premium, because these companies which sell these microscopes over the cost of 50, 60 lakhs, or they always target this 5, 6, 10 premium doctors in each cities. But majority of the premium doctors have now started looking at refurbished microscopes and refurbished phaco machines, because they have understood that it's not no more viable for them to buy these costly equipments, keep on buying them. But majority of the doctors in small towns like Karur or Namakkal, or these are the people who are now able to buy those OCTs which are 50 lakhs and microscope which are 70 lakhs, meaning there is a huge potential. People who have 1 plus crore turnover are now from smaller cities. They are per month are from the smaller cities. They are not from the bigger cities anymore, because bigger cities are already saturated and competitive. And now that we have these profitable options to exit is not a bad word. Anybody at one point of time needs to retire, and if you want to retire, why don't you retire profitably with selling and creating something of value? Because a doctor starts say at 25 years, and then he keeps on working till 65 or 70. You create something for 40, 45 years, but why should it die after you? I think you create a value out of it and then give it to, either you enjoy it on your own or give it to your children, or you can even donate it to charity rather than just closing down. Because many, previously it was most of the practices after one point, if the children don't become ophthalmologists, had to close down. But now these are the options which are available. So I think the mindset has to change in India, to think from egoistic mindset of a doctor to a more collaborative mindset of entrepreneur. And I think if we don't change our mindset, I think we will ourselves will be changed. So we need to change ourselves. So it's a very good time to start, and I think we are in the beginning of this eye care market explosion in India now, and we are in a very advantageous position to take advantage of this opportunity. And so only thing is, we need to leave those egos as doctors, and then don't look at the other ophthalmologists as a competitor. Always try to see how we can collaborate with each other, and if you do all those things, I'm sure we can definitely progress to the next level. So thank you, sir. So I think I took some time. So if we have any questions, we can take it now, or I can ask Mr. Srikanth to talk. We have time till 2:15. So no questions.
Very interesting talk. Very enjoyed it. Very statistics are very. Sir, what are the funding options for the hospital other than the banks? Like how a smaller hospital or a hospital in tier 2 city who doesn't want to take loan from a bank, what
I think basically funding can be either angel. Angel is something like your family, your friends, or somebody wanting to invest in you. Because when we are starting up, the VC is not going to come directly to you. So the next option you have, say, if you don't want to take a loan, you have to take money from relative. Because just like we don't have money, there are lots of people with money and don't know where to invest. So if you feel there is somebody who will really invest, who may not be aggressive or who may not be detrimental to your practice, most I think many doctors have followed in their initial stages, get some 40-50 lakhs from a relative or a friend who has that money and give him a 20-30% stake, and maybe in future have a reverse arrangement to buy back a stake also. You say after 5 years I'll pay you 3 times of this and buy back your share. That might be a good option if you have somebody who's understanding. Other than that, I think bank is the only option you have. Or there are these, I think in Tamil Nadu we have this TIAC, Tamil Nadu Industrial Investment Corporation, which is a bank but offers at a lower rate of interest. So maybe try those kind of options. Then the next option would be to go for venture capital or other kinds of investments. But they are going to take up equity, and VC is always not so easy to handle all those things, and they don't invest initially. So you need to have a scalable, proven model for before which they can come in. So if not bank, then I think only option is to get an angel investor. Venture capital, sir. Venture. So the money VC doesn't own his money, but it is like lot of people put the money in a VC fund, which he invests in other companies. Yeah. Yeah. Yeah, you can. I don't think there is any risk. So basically, so the earlier you start is better. So what is it preventing you from starting? Is it money, or is it you thought I should get more experience? I should get yeah. So you should not be doing what everybody is doing. No, that is the first thing. Don't do what everybody is doing. I'm talking because I don't do what the other doctors are doing. So. Mm. No, actually, as a solo practitioner, you should not be investing 10 crores in a hospital in the beginning, unless you are very rich. Unless you are very rich. So basically, I think vitreoretina is a specialty. If you are looking at anterior segment practice, most probably you may not have to invest more than 1 crore, including the OT. Without OCT and other things, all you have to need is. So we have worked with a lot of hospitals, so you need a space of 3,000 to 4,000 square feet as a single practitioner. For the anterior segment, you don't need more than 1 crore for the interior and equipments. And this kind of a practice will easily break even within say 18 months to 24 months if you are able to get 20-30 patients every day. And getting 20-30 patients is not very difficult in most of the places these days. So 20-30, if you are in a right place, if you the location selection is good, and if you are from the local area, you have the local contacts and everything, all you need as an anterior segment is 20-30 patients in a day, which can help you break even and recover back the money. A specialty practice like retina, definitely, unless you have a backup pool of patients, like unless you are already in a corporate or you already worked, you have a patient following, it doesn't make sense to invest 2-3 crores and start immediately, because to get back that money will take a lot of time. So basically, if you set up everything and sit, maybe 10-15 retina patients should be coming to you every day. So how are they going to come? Unless you have a referral base, or you created a name, or You are already in a corporate hospital where you have a patient following, or you worked in a charitable hospital where you can get the patients. So unless you have the following, you cannot. I don't advise starting. It is not an issue. I think we have a lot of time, so it's okay. So we can talk.
As a beginner, I would suggest we should keep our initial cost low.
Yeah.
Once the system starts working, we can anytime invest on bigger and branded machines. But no way the cheaper machines are bad machines. The lesson which I have learned over a period of 5 years of my practice. I started with lower amount, gradually practice improved, I started buying more things. But the pressure of investing in the initial days a lot of money does not give you that much time to think logically during your practice days, initial practice days. You're always under the burden of the financial burden which you have created for yourself before the start of practice. So don't ever get yourself in that position that you are everything you are seeing through the glasses of finance. Keep your working capital low. And as you grow, keep on moving. Buy the machines of your choice, buy the things of your choice which you want. But Indian or less expensive machines are not bad. The activities of your
Yeah.
office.
Yeah, I'll tell you. Maybe there is a question. Yeah.
What do you recommend? Like, should we build a patient base and then open our own clinic, or like open our own clinic and then try to reach out to people? And also, how to build a patient base?
So I think most important before somebody learns to starts a practice is when you do a fellowship, you learn all the clinical skills. You learn how to do a surgery. But what is more important is private practice is a different ball game. So have you worked? I will suggest everybody to work with a private practitioner who is in that area if he is accommodative, to work with them for 6 months, 1 year to learn what is private practice, because private practice is not the clinical surgical skill. Private practice is more about communication, more about managing a lot of things, more about staff handling, more about finance handling, all these things. So I don't know how many of the doctors will allow you to learn those things, but what you should learn is surgical skill definitely is important. Without that you cannot survive, but it alone is not important. What you need to learn is go to a big private practitioner in your area, spend some 6 months, 1 year with them. So I think that will help you grow as a private practitioner. And that patient base depends on it for you. How do you develop a patient base? It's very difficult to develop a patient base working with another private practitioner, because you cannot steal his patient's income. If you work in a charitable hospital or a corporate hospital make sure that their branding is more stronger than your branding, so they don't allow you to create your own patient base. Unlike a cardiologist working in Apollo hospital, so he can create a database of say 5,000, 10,000 patients. When he moves to the next fortis, all the patients will follow him. But as an ophthalmologist, it's not possible to, like say you work in ABC corporate hospital, unless you are very much focused on taking away the patients are not going to follow you, because patients came in for the corporate hospital brand, they didn't come for your brand. So it's very difficult to do that. Creating a patient base is difficult, but if you set up a clinic in a good location, because all you need is 20, 30 patients in a day, and with so much of population, if the clinic is placed in a convenient location, that patients will automatically come. And the initial 10 patients, how do you handle them? That will get you the more number of patients. And as a private practitioner, I think you cannot see more than 40 patients in a day. That's if you want to do justice to your work, the maximum you need is 30, 40. So you can, Dr. Ayush has started his practice, so he can give you the example. So he started recently, but has got that critical numbers to survive himself, sustain, and is on the growth phase. So basically, I think it's not a very complex thing. If you have the right place selection and take a little bit of risk.
Sir,
Yes.
if we want to open our own clinic after access, what is the right time to do fellowship? Like, after fellowship, we should open our own clinic.
It depends on what you want to do. Whether you want to be only cataract and anterior segment, or only LASIK and cataract, you don't have to do a fellowship. Only if you want to
In
super special.
anterior segment also, like if we want to do cornea, then what is the right time to do? Like, should we finish our fellowship and then
Actually,
There are two aspects to it. First is you have to make yourself professionally so much equipped that competent that you can treat a tumor. If you are not professionally competent, or insulin will not apply, because ultimately you will have to give results, but this is the case. Once you are professionally equipped and competent, then this gives you soft screening targets. The moment the day you are professionally competent, start serving. Because it will take some initial days to prove it. Even if you start 10 years after that, those days will still be needed to make your own name, to have some
actually, I'm not a fan of specialization because the more you get specialized, it's going to be more disadvantageous. If you are a DO, I think it's more better than being a DPNB or MS, FRCS. If you become a cornea surgeon, if you become a neuro-ophthalmologist, your chances of success are very low. So,
how many cornea patients you have in any of those medical areas?
so don't get more specialized.
I have tagged myself as a cornea surgeon. So I can still treat a medical retina. But those medical retina patients, I have excluded from my portfolio the moment I have tagged myself as a cornea surgeon.
So I think specialization doesn't help too much. There is a book called Range. You try to read that book. It tells you like, see, the most successful people are generalist. They are not specialist. So why did Michelangelo became most famous painter is because he had lot of specialties. He knew to sculpt. He knew to paint. He was an architect. He was a military warfare specialist. He had lot of these different skills which he used to juggle to bring those good paintings. So I think unless you are too interested in neuro-ophthalmology or in cornea, it doesn't make sense to specialize. So
There's also comprehensive ophthalmology.
yeah, that is a general. You learn everything. That is fine. That is fine. So skill, I think if you are confident that you can do cataract surgery on a private patient confidently and a LASIK on a private patient and satisfy him, I think that is when you should start your practice.
We
So
will probably assess at the end because
yeah, 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 yeah.